Thank you, Adams. Greetings. Thank you so much for coming to this information session to learn more about the Masters of Science in Health Informatics at the University of North Texas. As you can see in the slide that we have for you, it's a creating informatic leaders to improve patient care. Try a way that should give you an inkling, an understanding of what our program is all about. One of the things that make us different, and I want to tell you that from the very beginning, is that we're patient-driven. All our curriculum, all our activities that we do, it is with ultimate goal to really improve the outcomes of our patients. So this morning, I have the pleasure, that beside myself and giving you some background about the program, we have other members that they're going to be speaking to you. The first one is going to be one of our current students, and that is going to be Sweeya Spandana Alla, and she is the president of the Health Informatics Student Organization. And at the same time, we have added 3 different alums. We want them to talk to you about their experience while they were in the program. So we thought, okay, what would it be the first thing that you all would like to know? And we thought that there would be certain quick facts that would give you an overall view of what the program it is at the University of North Texas. First of all, we think you are in good company. This program has been nationally ranked. It has been recognized by our innovative curriculum, by the faculty that we have, and the research that we have. But most important also is the productivity that we have with our students, their participation in professional organization, the research that they do, and their publications. The other thing is that you can complete this program either in person, some of you will be most interested to do it online, or hybrid. And of course, this is going to depend on what is your requirements. Some of the students that we have today here, they're international students, and others are their domestic students. So it's important that you see what are your requirements in order to, meet your visa and one of the whether this is applicable or not. The other thing that we want to tell you is that the program has 36 credit hours, and that includes a capstone project, which I will tell you a few words about this afterwards. But most of the students that they complete the program either in 1.5 to 2 years. And that's always a question that we are asked, how long is it going to take you to complete our program? So of course, there's some flexibility according to how many courses you take, and also your visa requirements if you are an international student. We also want to say that along those lines, we will have what we think we are stellar in personalized advising and mentoring. We have a wonderful advising office staff. And also we have the mentoring, not only by them, but by the faculty. We take a lot of pride to get to know you as much as we can because we have a lot of students. But as you will see, we will have a number of activities that they give us the opportunity for you to meet fellow students as well as network with faculty. So when we say this, what are the opportunities that you will have at the University of North Texas? Well, we pride ourselves in giving what we call enriched learning experiences. And that is through, for example, lecture series. We have in the fall and in the spring, what we call the Health Informatics Lecture Series. And we bring experts in a wide variety of areas, in different subject domains. We have had as much as an astronaut coming to us and showing us how is it that they collect the health information data that they're needing here, how they're collected, how it's organized, how it's gotten, and he delivered on Earth. We have had, for example, individuals dealing with AI and applications now in all different types of subject domain. We have had the legal aspect and the privacy and security. We're getting ready now for April 9th to have our lecture for this semester, and it's going to be on security dealing with medical devices. So we bring experts, I said, national and internationally, and they give the latest trends, but also there's an opportunity for students to ask questions, and it's a form of networking. We also look at the demographics of our students, and we notice that there's a number of pharmacists in our program. So last semester, we had a marvelous panel coming from UT Anderson, from the Pharmacy Quality and Control Department. And they gave 5 panel members, gave us a wonderful exposure. What is it that is happening in that huge medical center? And mainly looking at the AI applications and security issues that they're having. So that's just one example of things. We also have another series that is chats with health informatics professionals. And we had that 4 last spring, 4 last fall, and we're just having 4 this semester as well. So we're taking time to say this, so for you to understand that we try to connect you, not only with the academic side in here, but also we connect you with industry. We connect you with individuals that they're really making an impact in health informatics, data science, in the healthcare industry. So there will be other opportunities for you to, for example, orientations that we have. We have had program workshops, for example, how do you write your resume and so forth. So this is just the tip of the iceberg, but to tell you what is it that you will expect from us if you come here. The other thing that we want to talk to you about is the hands-on research opportunities that we have. We're emphasizing more the research opportunity for the students to collaborate with faculty. And we have had now the new 2 health informatics labs. And one of them, we have been labeled HEAL, and we think that's a clever name because it means that health informatics, empowerment, and adaptation. Now, notice the 2 key words in here, empowerment. It means that you are going to be empowered. You're going to have the skills and tools and knowledge when you get out at the University of North Texas, knowing how you can make an impact in healthcare. No matter how small you think that impact is going to be, we really are committed, and this is not just talking, to leadership and see what you can have. So we hope to empower you with this knowledge that you can make a difference in patient care, in how we deliver health services as well. And then adaptation. Think about the term adaptation with all the changes that we're seeing about AI and how it's changing the landscape that it is in healthcare. So we want to empower you, but also be able to teach you how is it that you can adapt to change. So these are quick facts that we have about our program. The next thing, so that's an overall look at. The next thing that right away it comes to the question, how much it's going to cost me? And of course, all we can do here is to give you an estimate. This is what is happening right now. And we give you the link here in the website that you have for the University of North Texas, the tuition cost that we have. So for the fall 2024, the spring 25, if you're an international student, we're looking about around $8,000 for 9 credit hours. And that is what most of you will be taking if you're an international student because of your visa requirement. There will be some exceptions, you're finishing the program. And to the end, you might be needing just the capstone course. And there will be ways that we can manage that. But as a whole, we want you to think about it, that you're going to be taking 9 hours per semester, at least in the fall and in the spring. And then we can come and we are looking.
Dr. Cleveland, can you unmute yourself? It appears that you are muted at the moment.
Oh, thank you.
Okay, thank you.
Don't-
Please continue.
Thank you. Okay, so we have, of course, options that you can, and most of it is the domestic students that they're taking these options that we have. You can do that all on campus, and they will be over $4,000. But also we want to tell you that we had the capability for you to take the whole Master's of Science in Health Informatics as an online course of the program. Next. So once we have told you some quick facts and we have told you the cost of it, we always get the question, what is the overview of my degree? What is expected of me if I come? And sure, you're going to be able to look at this on the website. But here you get a bird eye view of what you can have. And we have certain required courses, which is 9 hours. And like, remember, we mentioned to you that the program was 36 hours. And not only we have those introductory courses, we think it's extremely important that you deal with introduction to health informatics, introduction to health data analytics, and then information systems. And these are mainly the health information systems, right, in healthcare. So in these 3 core courses, basically what you're going to see is the intersection of the healthcare field with IT, informatics tools, and data science tools. So we made a point in here, for example, that you're going to be dealing with health data, you're going to be dealing with the electronic health record as an information system, you're going to be dealing with data privacy, security, and also as well as what are the government regulations and how is it that we administer these systems. And when we deal with government regulation, of course, you're going to be looking mainly at the United States, what is our laws that we have in place. But that doesn't preclude you that since we look at the demographics, we also look at it in a global perspective. I think the other thing that is important for you to look at it here in these 3 courses, you're going to be looking at the information system from a clinical point of view. Of course, you're going to look at it from an administrative point of view, but also for a financial perspective. So you're going to get a broad perspective about health information system and how is it that they are the trends in delivering the healthcare. We mentioned the healthcare, electronic health records, we mentioned for telehealth, and then also you're going to be being exposed to Python, you're going to be exposed to SAS, your SQL. So that is some of the content that you are going to be taking in these required courses. And then there are other categories of courses you have. That's 9 hours. Then we come what we call guided electives, and those are 15 hours. And you have here a suite that you can, of courses that you can select from it. And we always expand in these. As we get new faculty and they have certain expertise, and I say, we want to teach this course. But here, these are the ones that we have now and that you will be able to see in the web. And so, for example, we have a course in legal and ethical issues in health informatics. We think it's extremely important, especially as we're looking at now with the new technology and AI. What are the ethical issues from a perspective, not only from an institution, a healthcare institution, but also from the perspective of the consumer of health services. And we call it the consumer health services because it's not only the patient, but the caregivers and others do it. So we deal with research methods, of course, what is the terminology and standards that you're going to be using in the field. So you're going to see, and then we have a wonderful course called Artificial Intelligence in Health. There you're going to be looking all kinds of applications, and we are looking now at teaching an advanced course in AI. So searching the literature, how is it that you look for evidence? So you can, I'm not going to go through every single one of them for you to see that this is guided. And then we have some general electives. And again, this is 9 hours. And what you're going to be looking in here is we cater this to your career goals. There might be somebody who is looking for community-based health information. How is it that I do outreach to the community? And here we have an embedded part of public health in this course. You might be looking at genomic, precision medicine. So there is, again, some options that you can have due to your background, the subject domain that you bring, what are your career goals, and then here also give us a flexibility of courses that you can take outside our College of Information from the Department of Information Science. We are very interdisciplinary, and we want you to also, we look at see, okay, where is it the journey that you can take in your profession, and that we can adapt. So far, the last thing that is going to culminate the program that we have is going to be the capstone project. And this is project-driven, as is, mentioned in the title. And I just want to give you an example of two, we just finished 2 projects that we have. One of the students deal, for example, the application of large language models, specifically looking at ChatGPT and how to ChatGPT-4 and how to extract data from dental images was one. The other one that was very exciting about it, it was a competition, a national competition with another health informatics program we joined and an insurance company. And so the insurance company was looking at what are the health records that they have, the patient records, and see where were those patients that they were unengaged, those of them that they were not following up to their visits to the primary care physician or with a specialist. And so they tried to understand why there was that engagement. And of course, because that will have an effect, for example, on the outcome of the patients, the healthcare outcomes that we're looking at. So that just gives you an example of 2 projects that we have done in Capstone. And so this gives you an opportunity to be really creative, innovative, and then focus in an area that you might be interested in. So this is an overview of it. Another thing that we feel that coming to the North Texas is going to give you an added value that we have. We call graduate academic certificates, and those are 12 hours. They have 3 required courses and 1 that is an elective. And there are 2 categories. You might want to do this or you might not want to do this. This is, like I said, this is in addition to your master's in science in health informatics. One deals with health data science and the other deal with health information. And so one we're doing is applying data science methods and techniques to health-related problems. And the other one is more about information. And how is it that you deliver that information, whether you're serving the user, the patient, or it's going to be how you embed that information in health information system. So the question is, are you going to be having to take 12 extra credit hours? And the answer is no. So what we have done is that when you're looking at the inventory of courses, we look at your degree plan, you're going to say, I have taken these courses and I want to take this. And it's planned where not only you get the master's degree, but also you get a certificate of advanced studies. So remember that, that's an added value that we have. So the next thing is, who is going to be delivering these courses? I think it's always important who's going to be impacting me. And still the main thing is for you to know that we have a very interdisciplinary faculty dealing with a number of subject areas that they become expertise in information science, health informatics, data science, computer science. And we say they are more because we research out. For example, you're interested in geographical information system, we go to the geography department. If you're interested in biomedical, we have, and precision medicine, we have a wonderful partnership with the biomedical engineering department. So these are some areas also that we have active research for you to know that they were dealing with this. And some of them, not only the large language models that I mentioned before in healthcare, but for example, adverse drug reactions that we have one of our speakers today going to mention, disaster management, dental informatics, and so forth. And of course, we conduct a lot of things with the professional associations. The faculty have a strong presence on it. So the next thing is, what are the careers in health informatics that some of you might be interested in? Here we have some sample titles. Senior Director in Health Informatics, Clinical Informatics System Analyst, Pharmacy Informatics, ER, Electronic Health Record. Maybe you're dealing with a data coordinators. And in the picture, for example, that you have in here, we have one of our graduates that is a clinical data coordinator, and that was part of coming and speaking about the chat with a health informatics professional. The person came in person. Many of our speakers also come via video. The other thing that we ask in here is, what is the average in the salary? And according in Dallas, this is what can you expect nationwide, but the range also varies. We always ask, where are our graduates working right now? And this is a nice inventory, we think, of recent graduates. Population health informatics analyst, and this is dealing with the Tarrant County Public Health Department, and this is just down the road in Fort Worth, Texas. We have also to show you that not only we come here, but we go to Louisiana. We have someone that works also for the Department of Health, Clinical Data Analytics. We have someone dealing with public business analytics for a National Public Health Informatics Institute. So in the screen, we have brought up some things, some Blue Cross Blue Shield of Texas, a senior analyst consultant. We have another data analytics dealing with another group, a medical group. And we have a clinical data coordinator for Pharm Clinical Service. So that's the pharmaceutical company. Providence Health Services is a major healthcare system, a group that we have here in the United States. So as you can see, there is a breadth and in the scope that we have in here of the places that we have been able to find job for our students. So now I'm going to turn this to the other individuals that we have this morning to talk to you. And this is the perspective of a student, that she's the president of the Student Association, and as well as 3 graduates, and telling you what's doing. You can see here how we have an orientation. We have a picture as well, telling you how we have students that they work not only in the labs, but we are at Discovery Park, which is a beautiful building, and it have a lot of opportunities for you where to work. Okay, so now I'm going to pass the baton, I would say, to Sweeya. Sweeya, will you please mention your name and where is it that, what is it that your capacity
Thank you, Dr. Cleveland.
in the program?
Sure. Hello, everyone, and good morning, Dr. Cleveland. I'm Sweeya Guntupalli, and I'm the current president for Health Informatics State Organization. And this is not my first year, but I'm also being part of this organization since the beginning of the organization, since it's founded by Dr. Cleveland. So I would like to talk about the Health Informatics State Organization in today's session, and we also call it as HISO, a cute name for our organization. And the main motive of our organization is to promote student exposure in the rapidly developing field of health informatics and to advocate the interest in terms of their activities, informatic resources, facilities, and other forms of assistance. We, through organization, helps the student to identify the available resources on campus, because it's not easy for the new student to identify what are the resources available on campus, but we do guide you and we do help you out once you reach us out, to let you know how you can find and so on. So let's say if someone comes and asking about where is the advising office, most of the new students are not aware of that, but we can help you out. We can say in the discovery part in the second floor, you can go there, you can find the advising office, we can help you out, like such things. It's also part of our organization. And we through organization conducts a social events like networking events. You can see the picture over there. It's there with all of our officers. It's from our networking event. We have a very good number of students at the time. We got a chance to connect with the faculty, some of the industry experts, and it's not only for the health informatics students. We always welcome from other departments too. It's open to everyone. And with be through organization helps with to conduct the workshop sessions about the resumes, cover letters, with the help of our career coach of College of Information, Anna Moots. She's very supportive, and she always, when we ask her if you need a session about the advising of on the resume or the cover letter, she always says yes. And okay, let's say it's not only about the professional academic, but we do also prefer to have a gala event. It's a once in a year event. This is the event we say farewell to our graduates, and we also welcome our new team of HISO. And this is all the success, whatever we achieved, whatever the name or whatever we have, it's all because of the one person the person having the continuous support. It's because of Dr. Cleveland. She's there from the beginning. She always supports us. Whenever we give the idea to when we propose some ideas, she say yes. She always support us, and with the help of her and with the help of our previous um, co-advisor Dr. Avinash and Dr. Spandana, we have reached many students right now, and we're growing into a big family now. Um,
Okay,
yeah,
thank
that's
you
it
so
from
much.
our organization. Thank you so
Thank
much.
you
Thank
for
you, Dr.
that.
Cleveland.
But it takes a village to really run this program. There are many people that thank you for the acknowledgement. But also, if we're doing acknowledgement, we have to acknowledge Dean Kenchik because without him, we would not be here. Okay, so Dr. Patula, we need to keep moving. Thank you, Dr. Avinash. Thank you so much, Lisa.
Thank you, Dr. Cleveland, for giving me this opportunity. Hello, everyone. This is Dr. Raja Avinash Potla. I earned my bachelor's degree in dentistry from Dr. NTR University of Health Sciences in 2018. And after that, I worked as an assistant dental surgeon before transitioning into the field of health informatics. In 2021, I joined for a master's program in information science with a concentration in health informatics and graduated in spring 2023. During my academic journey, I have worked as a teaching assistant, research assistant, and course instructor. So as for my research assistant experience, I focused on dental informatics research and co-authored a study titled An Analysis of the Dental Informatics Literature from 2018 to 2023 on the keyword extraction using ChatGPT, AIC, and AI models, which was presented at the UNT Day of Health Informatics and Data Science in 2024. So in my role as an adjunct faculty member, I mentored the students, developed the course materials, and connected theoretical concepts to the practical healthcare applications. So additionally, I'm teaching a lab of SQL and taught the students of essential skills in database management, SQL querying, and healthcare data analysis. So looking ahead, I am to contribute more to the health informatics program and research, fostering innovation in this field. It's truly a pleasure to connect with you all, and I look forward to having engaging discussions and exchanging ideas and exploring future collaborations. Thank you.
Thank you, Dr. Avinash. Thank you very much. And as always, your contributions to the program. Okay, so Dr. Alla. Dr. Alla.
Hello, everyone.
Okay.
Nice to see you all here. Thank you for joining. Thank you for the opportunity, Dr. Cleveland, and mainly for the Dean Kinship for organizing this event. My name is Dr. Sweeya Spandana Alla, and I have done my Doctor of Pharmacy back in India, and I joined the program Information Science, concentration with Health Informatics here. in University of North Texas, and I'm proud to be a graduate of this UNT. And uh, I got an opportunity to serve as teaching assistant and research assistant after joining here. And mainly coming to my research work, I had an good opportunity to do a research here with my professors, Dr. Anna Cleveland and Dr. Hee-Jun Kim, and which is titled as Attention Deficit Hyperactivity Disorder and Related Adverse Drug Reactions. In this research, we have done a long-term study on how medications work for ADHD and what are the safety rules and how it goes in the post-marketing surveillance, and we link with the adverse drug reactions. And we have expanded this more with doing some presentations in the most biggest conferences like SCC MLA conference. And there we achieved an award for this presentation. And we provide lot of information regarding this ADHD, which is real world implications and which is good for healthcare providers and policymakers and patients. It's very beneficial to the patients to understand what's going on after they take the medications, how they face all the adverse drug reactions. And we studied about all the post-marketing surveillance as well. After coming here, by doing this research and everything, I fueled my all the passion, and I found this course is right for us. And the opportunities you will get here is lot. You need to grasp everything. I feel you're in the right place. I see you all here to get all the opportunities. And right now I'm searching for a job, and my research experience is helping a lot for me to hear, and it's all welcoming for you here. And the faculty is very most precious here. I feel
Thank
you'll
you.
make a good opportunity here. Thank you so much.
Thank you, Dr. Alla. So Dr. Alla is a good example that in collaboration with me as well with Dr. Kim is one of the faculty members in the Health Informatics program that was done with Dr. Patula and Dr. Avinash. His research, he also have been in collaboration. We have worked with Dr. Haiwa Shin. So this is also illustrate that the faculty gets embedded with the students on this research, and then there's publications and there are opportunities to present in professional organizations. All right, so the next one, Manisha.
Hey,
Thank
hi.
you so much, Dr. Alla. Okay, Manisha, please.
Yes, Dr. Cleveland. Hey, good morning, team. So this is Manisha. I have completed my Doctor of Pharmacy, and then I worked as a medical services analyst in one of the reputed company. Later on, I moved to Texas, and
Manisha?
then I have graduated in May 2020. Yes, Cleveland. Can you hear me?
You're breaking a little bit, so let's see. If not, we're going to have to move.
Okay.
Can you talk? Well, Manisha works as an electronic health record data analyst and in a very large company. And one of the things that we wanted to bring her is as an example of, recent graduates that they have come, and many of you are interested in data to become a data analyst. And so, but I'm going to have to move because she's breaking and we are not able to hear. So at this time, we would like to, if I, from Adam, we are going to just finish our presentation. I think we are going to open it for question and answer period. Before we go up in this part, and we want to, from the perspective of the Health Informatics, the Master of Health Informatics team, that we want to thank you for attending this, and we really want you to be part of us. We want to look forward to meeting you. And I think, Adam, at this time, do you mind opening the question and answer period?
Yes, Dr. Cleveland, I am stopping the recording now.